Good morning, everybody. Thank you so much for those of you who are joining us in the Zoom. Thank you to those of you who are joining us on Facebook. Really, really excited to be with you this morning for this very, very, very important conversation as well. So if you're on the Zoom, we're asking you please share who you are and where you are joining us from. So kimunouye eto tetu et kikote usote kunya kikoto yek à ce moment-là, right? And so that way we can get a chance to get to know each other on the Zoom as well as on Facebook. So if you are live on Facebook with us, please put on the chat, let us know who you are and where you're joining us from, so that way we can be connected to you. So if in this particular moment. So really, really excited to have you all be with us for this conversation about addressing children's mental health now. And I'm very excited to be joined by two very important dear friends and colleagues to me for this conversation as well. So my name is Guerda Nicholas, psychologist, child and family psychologist, professor at University of Miami. And I am joined by the amazing Rachelle Sylvain, who's has been a central part of this work for many, many years. So I'm going to ask her to introduce herself a little bit, and then I'll do the same with Dr. Janac. Yes, Professor.
Good morning, everyone. Good morning, everyone. I am Rachelle Sylvain Spence, and I am a social worker who practice through a Fury Aesthetics and Wellness. So currently I focus primarily on the life and wellness component of individuals. Happy to be here.
Awesome. And then, of course, we are joined by the president, best president there is, the Dr. Janac, president of Rebati Sante Mentale. Good to see you.
Yes, good morning. Bonjour tout le monde. Good morning. My name is Dr. Natacha Janac. I am the president of Rebati Sante Mentale. I am a licensed mental health worker. I just love the work that I do. I love working with children. I love working with families. I love working with the Haitian population, the Caribbean population, Black and brown people, name it. I love doing it. I love this type of work. And I feel like, it's a community work, right? Everybody has to take part in it to make sure that it works. Thank you, Dr. G, for putting this together.
Thank you so much, ladies. Thank you so much for being here. And thank you so much for all the amazing work that each of you are doing in your many ways as a part of this. Let me just say very quickly for those of you who are joining us, the purpose and the objective of us doing this workshop today was, one, to raise awareness of the importance of addressing mental health issues among our kids right now. And second is to really talk a little bit around how early intervention can really play a significant role in addressing some of these challenges that we are seeing and the long-term effect that many of these things are happening. And then thirdly, we wanted to provide some practical guidance to parents and people who are working with kids, all people who are working with kids, not just parents, right? So whether or not it's the grandparents, it's the aunties, the uncles, right? Everybody who's working with kids, to really provide some practical guidance on what we can do at this particular moment as well. And then lastly, we never want to lose sight of the cultural aspects of all of this, because not all families are the same, not all kids are the same. So it really is important that we keep that in mind as well. And you'll hear a little more about that through this presentation today. So I want to kick off a bit to say, why is it that we decided to do this webinar now? And we saw an urgency of that now for the most part. And I'm going to share with you a few slides in a minute, but I want to provide you a few anecdotes of what we have been seeing in the last couple months in this community. And I'm sure that both Rachelle and Dr. Janac will also add their own things that you also probably are seeing in the community as well. I know that as somebody who's overseeing a department that has a program at the University of Miami, that is a mental health counseling program where we are training mental health clinicians, which means I have about 30 of my students out in the field who are seeing, families and kids in the community. And so we get a pulse of what's happening in the community. 7 months ago, Nicholas Children's Hospital, number one reason for hospitalization was because of suicide or depression among young people. So think about that for a moment. A whole hospital, right? That are seeing an increased rate of hospitalization among young people simply because of depression and suicide. But in addition to that, I would say in the last 5 months, I have received 4 disturbing cases report from family members, and they are as young as 8 years old. So an 8-year-old attempted and completed suicide by hanging herself. A 9-year-old jumped out of the balcony of her family's home, broke several bones associated with that. And then a 14-year-old took every pill she could find in her house, right, to take as well. And then we have an 11-year-old boy who actually went in front of a car and was hit by a car. When anybody would say, oh, this kid got hit by a car, but it turns out that actually the kid hit the car. Like he planned exactly when he thought he could do Akile at the exact moment that he thought he had a likely chance of being hit by a car. So I'm sharing all of that to say the situation and the things that our young people are dealing with is real, and we cannot afford to actually not take this seriously and not be intentional about the kind of conversation that we do need to have about young people and what's happening with them in the community right now. So I'm going to pause to see from Rachelle and Natacha. I'm sure you two may have been. I know that when I said we needed to do this, you guys says we in. There must have been a reason too. You said you in as to why that is as well. So I wonder if you can share a little bit around what is it that you are also hearing, seeing, right, and experience also of kids in our community right now. You see, let me turn to Natacha first. Natacha.
Dr. G, I echo everything you're saying, right? And so what I'm seeing more so is looking internal, right? Right. So the thing is, a lot of us do a lot of this work that we do, but you're not really paying attention what's going on in your own family, right? The pressure is real for these kids. They talk about it all the time. The pressure of playing athletic sports, the pressure of school, and the need to just, be something their parents want them to be. And so sometimes they don't have that outlet. They don't have that, people to talk to normalize the fact that you don't have to be this star athlete. You don't have to be a great A student as long as you're trying your best. I know that is something that sounds sometimes very cliche. It's like doing your best and that's not enough. Doing your best is enough if you know that is, you gave it all you got. And so a lot of time that pressure is put on these children and they don't know how to express it. They're afraid to tell their parents because sometimes their parents spend a whole lot of money on the sports and, traveling. So the parents are like, pretty much suck it up and they just kind of like hold it in. And it's kind of like a ticking time bomb. And then when they just can't anymore, they feel like there's nowhere to go. And so I see this like every single day. I talk to these children. They sometimes want me to talk to their parents, but then sometimes they feel like their parents won't listen, right? So I hope after this presentation, if any of the parents are able to, to watch us today, kind of like step back and really take some of this thing in because it's really time to make a change in the way we're raising kids. Yes, we may have been raised one particular way and we turn out okay, but I think the verdict is still out on that, right? We don't know we all turned out okay. And so it's really now time to kind of like change some of that up to make it not so demanding on these children as long as that, they are doing their best. So I echo everything you were saying because I see the exact same things, the statistics. And at Nicholas Children's Hospital, I did a practicum rotation there. And especially around this time, it gets really, really busy. And so parents have to be more mindful of, their children well-being. It's not all about academics and athletic. That's the point where I'm coming from, because that's where the main struggles that I see.
That's great. Thank you so much. Thank you so much for sharing that. Rachelle.
Well, I echo it as well. Obviously, this is why we're here. And besides a practitioner, being a parent myself, I've either witnessed some of the struggles that my own children have had and either their friends have had because of some of the stuff that Dr. Janac mentioned, but also their lack of understanding of who they are. And depending on the stage of life they are, of course, I mean, a younger child may not they haven't developed enough to really get a sense of who they are. But are you talking about a young adult, adolescent? They're getting to the space of interaction with others, students, other friends, and also the peer pressure, the confidence issue, and also to the need also to catch up with the Joneses. And there's that piece also that's very important, and that kids are facing is that how with the social media also being a big, huge part of their development nowadays, which is different how some of us have grown up, and not understanding that what you see in social media does not necessarily reflect the reality of your life, where your circumstances, your situation, and how you're moving through life. So I do believe that community is a huge piece of assisting these young kids. The home, us as parents have to be educated, re-educated, understanding some of the signs, and knowing when to pull your resources or tap into resources, and as well as the school system. So there's a lot of different pieces that can help support some of these young kids, but understanding that they're going through challenges because the season that they are in their life, the generation they're part of, which is different to our generation, and they have to face that, and echoing as well as the expectation of parents and community and the world as a whole. Politics also is a huge part of that as well.
Absolutely. I think that one of the things that I'm hearing from all of you, and which I think is important, it's not that all three of us here, ladies, have parents, and just so we all can tell you, right? So we're raising them at different age levels, right? But we're all parents, and we can tell you that we are seeing the kind of experiences that our kids are having. So it's not that we're coming to you as professionals today and just to talk to you about some of the things and why this stuff is important. We're also coming to you as parents who are also raising kids in this day and age to also tell you like the things we are experiencing as parents and why having these conversations and making sure that they are part of the dinner table, they are part of our everyday way of dealing with things is so really, really important. The reality is that we're not living in good times right now, right? We are not living in good times, not in this country, not around the world, right? And so if adults are not okay, and many of us here knows that adults are not okay. As adults, we're not okay. Imagine what that looks like for our kids, right? In terms of how they are managing things as well. So this is why I think understanding whether or not it's social media, understanding all the different systems that our kids are a part of and how that's contributing to their overall mental wellness, I think is important. And let us say the caveat at the offset. We know that there are some of our kids who are doing great. Some of them are doing just fine. They are able to manage the stress, the challenges, the adjustment, and some of them are doing okay. And then there's those kids who look like they're doing okay, but they're not doing okay. Okay. And then let me just say that again. There are those who look like they're doing okay, but they're not doing okay. And we can understand that because as parents, we know how as adults we sometimes show up and we're not okay, but we look like we're okay. So we can imagine that young kids knows how to do that as well, right? And then of course we know that there are the kids who are not okay and they tell us they're not okay, right? As well. And so this is why having this conversation today in multiple levels really is important. I'm going to open my Zoom just to share with you a few just opening slides just to set the context for us for the conversation. And then I'm going to turn things over to some of my colleagues here who are going to, continue this conversation. So I want to talk a little bit about why now, why we're doing this. And I think we've already started by setting up the tone for why we decided to host this conversation and the things that we are seeing in the larger community as well. So we're going to highlight this sort of urgency and really set the stage for why understanding these things right now is really, really important to all of us. And I think we've shared a bit of that. Here's what I think is really is important. Like, we have to understand the severity of the problem that we are dealing with right now with our young people, right? Here's what we know. I don't know if you knew this, Rachelle and Natacha as well, is that most of our young kids, when we're looking at depression, anxiety, most of it started before the age of 14. Think about that. We may not be able to be seeing somebody until they're like in college, but it turns out that the anxiety and the depression, most of it started before they were the age of 14. And in fact, if you look at schizophrenia, like, even though we're not diagnosing schizophrenia until about 21, 22 among people, most of the signs were already there during their teen years, right? They just were masked, looking like they were oppositional, antisocial, but most of the signs and symptoms were there very early on, right? The other thing that we do know, and as a professor on a college campus, every time another child graduates, I said, we need to celebrate them, because the college completion rate is 55% of kids who goes to college graduate college. So when you have a child who graduates college, that's a celebration, right? Because it tells you that there's the number who didn't finish in terms of that. So it really isn't, and there's lots of reasons for that, right, as well. So because we spend the time knowing to some extent whether or not the child started to see some symptoms in their early years, but then we say, no, that's because they're teenagers, So the 13-year-old who's starting to act a particular way, we equate what they are experiencing to their age, to that time, to their developmental period, and therefore we're less likely, right, to address that. But the long-term effect of that is severe. So think about that for a moment. You have a 13-year-old or 12-year-old who's managing depression or anxiety, right, of some sort. And then they're dealing with the pressure that Dr. Janac was talking about, whether or not it's sports pressure, academic pressure, and then you send them to me on the college campus. Now they're away from home, right? And so on. And now I understand why on the college campus, we have to increase our mental health services on the college campus because of the difficulties many of those students are having, because we're talking about the untreated aspect of this. So from the age of 13 to the age of 19, 18, 19, when I get them on the college campus, they haven't seen anybody. And all of us know, who are in whatever field you are in, know that when you have something going on and you don't treat it, it becomes chronic. When it becomes chronic, it becomes harder for you to be able to address, right? So we know that there's a big issue with that. What are all of the ways that then feeds in? So once you have this chronic piece, now it's going to have significant impact in other areas of this child's life. And then those areas, then it's a cycle effect. It's going to fuel the anxiety and the depression again. So they're depressed and they're anxious. They're not getting the treatment. As a result of that, what happens to their grade? It starts to drop, right? So they're not doing well in science. They're not doing well in the class, but they're still getting pressure to do well in class because nobody's addressing the root cause of why is it they're not doing well. So now they're not doing well in their classes. Because they're not doing well in their classes, that makes them feel a certain kind of way, as Rachelle, you were talking about identity, right? And so on. So now that makes me feel like incompetent, and that feeds my depression and anxiety some more. Then that also is impacting their social interaction, because now they're down, they're anxious. So now they're spending more time in their room, right? More time by themselves. They're not hanging out with other people. They don't want to do other activities, not just with friends, but with you as parents. They don't get excited about going on vacation or in engaging in social activities and so forth. So that has a huge impact on them. So now they're spending more time in their room, more time scrolling through social media, more time being isolated as well. And all of that leads to this chronic mental illness in adulthood that we're talking about. So essentially, the child is carrying all of that now into their adulthood, right, as well. So really so the reason why we're saying now and not later is we don't want the 18-year-old, we don't want the 24-year-old, right, who's depressed because they've been depressed since they were 13. We want to be able to address what's going on with that child really, really early on as well. The other thing that we want to mention very quickly is the power of acting early. It's not that we're saying do this early because we're just talking about it. We have really good evidence to show that if in fact we do this early, it works. It works. It allows the kid to have a much better life if in fact we're addressing this early. So it's going to reduce the severity of the symptoms. This is not a big thing at all to understand, right? That we can understand that if I start to have a headache and I have the first signs of the headache and I take something for it, I'm less likely to have a severe headache. So we know that acting early reduces the severity of it. We know that identifying and treating it early is going to lead to better developmental outcomes. It's going to lead to less complications in the future. It has less long-term effect and overall, like you're building a stronger human, stronger person that you want to put out into the world, right? As well. And so really, really important to act really early on. But having said that, we know that there's a lot of barriers that we also need to address in terms of the care. And that really is important as well. So that we know the stigma that can continue to exist in our community, right, as well. So for me, for example, if I'm talking to the parent whose 11-year-old son planned to actually go and get hit by a car, right, and ended up in the hospital from major injuries from the car accident, the parents more interested in saying my child was hit by a car than my child attempted to kill himself by throwing himself in front of a car. See? So we know that the stigma exists in the community in terms of how we think about these things and how we discuss them. We know that there are some cultural stuff that gets in the way, right? Particularly as we're talking about, like things like schizophrenia. Without it, that somebody thinks somebody did something to the person, right? Because the child was okay and suddenly they're not. There must be some cultural reason for that. So hopefully we'll talk a little bit about that as well. But there's the fear of being labeled or judged as parents, right? That was like the biggest thing. Like, what would people say about me as a parent if my child did this, right? Or if my child is experiencing depression or anxiety and so forth. So we know that that's there. And then, of course, like the fact that we don't have a lot of culturally competent providers, but I know Rebati is working on that to making sure that we have a directory of an association where people who are doing this work can all come together into one place. So it's easy for you to find a Black psychologist, a Black mental health providers, a Black psychiatric nurse, a Haitian one, right, as well, a Jamaican one as well, like, so that you're able to connect with somebody that's much more in tune to your culture as well. So I want to say clearly what we're saying here is how important it is for us to start early, which is really what we're hoping to do today, and really engaging in these presentations that we're about to share with you today around not only understanding the early signs, but also understanding the kind of intervention that we can use. So really super excited because Dr. Janac is really going to talk a little bit around the early signs of this so that all of us here, and she's gonna break it down for us in language that we all can get today. And then Rachelle is gonna come in to talk about the strategies that we can use, right, to address some of these early signs. And then I'm gonna come back and then share with you a little bit around some of the family stuff, right? What the family needs to know and ways that we need to support families during these particular times as well. And so with that, I'm gonna say, let me close my screen and say hi to those of you who are joining us. And again, please share who you are in the chat here in the Zoom and let us know who you are and where you're joining us from. And for those of you who are on Facebook, we see you. We see those comments and so on. So please let us know who you are there as well. So with that, I'll turn things over to Dr. Janac.
Thank you, Dr. G, for that introduction. Quickly, are you able to see my screen yet? I'm not even sure.
Not yet.
Not yet? Okay.
Mm-hmm. Yeah, it's coming now.
Like it's popping up now. Okay. Yeah, so thank you for that introduction. And like you mentioned, this work is so important because it's where it starts, right? It starts, we just wake up and now we're adults dealing with life. All this stuff been kind of like piling up. And if we can start with the early signs, we'll be able to alleviate a lot of mental issues before they can even develop. So in this presentation, what this presentation aims to do is to educate educators, which are, our teachers, anyone who is with our children at the schoolhouse, right? And the caregivers will be mother, father, foster parents, grandparents, aunties, uncles, whoever is in the home raising the children, the importance of early identification and intervention for mental health issues. We'll also cover the key signs and symptoms in my section on mental health issues, screening tools and resources, and strategies for supporting, right? Because when it comes to educators, the teachers, right, they spend 8 hours a day with the children, right? And not just the teachers, the cafeteria workers, people at the schoolhouse, they spend a lot of time with these children. Especially a child who, takes their lunch and goes sit in the corner somewhere, right? Or even because I've had this situation where I had children who tell me that they eat in the bathroom. Nobody is seeing this because they're not sharing with their parents. They're not sharing. But at the school, if people are paying attention, they'll be able to see some of these signs already to see, like, why is this kid often isolating themselves, right? And then for the caregivers who are in the home, paying attention to the kids will really help as well, because these children, that you are the first things they see before they when they wake up, and the last thing that they see before they go to bed. So giving them, positive words in the morning when they first wake up to start their day, and then letting them go to sleep with some positive thoughts in their head, all of those things go a very long way. And as caregivers and educators, we have the opportunity to help in that area. So why is early identification, why does it matter, right? So early identification interventions are critical for supporting the well-being of these children, because research have shown that 1 out of 5 children experience mental health disorders. On the positive side, early identification intervention can improve the outcomes and reduce symptoms. And on the more not so positive side, untreated mental health issues can lead to negative consequences, such as what we mentioned before: poor academic performance, social and emotional issues, and isolation. And it can increase the risk of substance use. That's something a lot of people don't talk about, but I've noticed even in my profession, when I'm doing intakes, people will say that, they started doing drugs as early as 9 years old. When I first started hearing that, I was kind of like set back for that, because I'm like, how does a 9-year-old get, addicted to marijuana or using substance, right? Because these signs and symptoms are again unnoticed. And then these kids start using their own method to start healing themselves, things that they think will work the best for them. So then they start using these things. But if people are paying more, just all you got to do is pay more attention to these kids. And that's why educators and caregivers are so important in these roles, because you are able to catch these things before they can even happen. So let's see. Develop
That's so interesting. Dr.
mental
Janac.
milestones and behaviors.
Dr. Janac, you know what I was gonna share? Can you hear me okay?
Mm-hmm. I can hear you
I
now. I'm
don't,
sorry, I have some glitches, but you can go.
yeah. Do you remember just a couple of years ago we were dealing with the idea of the kids doing the bowl party when you were talking about the substance abuse kids?
Mm-hmm.
Remember that? Which is
Yes,
so
yes,
popular
yes,
in the
yeah.
high school, and
Mm-hmm.
most parents don't know what that is, that kids would literally go into your medicine cabinet, just take a couple pills or their grandparents'
Mm-hmm.
pills, and they don't know what it is. And they would do a bowl, BOWL, bowl party, where they would put a bowl in the middle
Mm-hmm.
and then they would put the medication in the bowl and then they would all take from it,
Yeah,
right?
yeah, and that's very scary, right? Because they don't know, right? So admission to the party is just bring pills, bring whatever pills you can find, and you throw it in the bowl. You take a handful when you get in, and you're just taking these pills. These children have absolutely no idea what they're taking, right? So I'm glad you brought that back up because when I first heard of that concept, and I'm like, parents don't know about this. I know I've never knew about it, one of the children I was treating shared that information with me, and that's kind of like one of the ways they started um, with their substance use issues. And so that's another thing parents need to be aware of is making sure that the medicine that you have in your medicine cabinet, sometimes just put them away, because you never know what the kids are going through during whatever time they're going through, and they are finding their own ways to start healing themselves.
Dr. Janak, can you share, because you had a stat in that other slide that says 1 in 5. And I think sometimes when people hear stats, they just think of it like they just gloss over it. They're like 1 in 5. Can you break that down for us? So what does that mean if I have a family of 8? If I'm a family, or I have a bunch of cousins that are getting together, what would that mean?
Well, just in very simple terms, like let's say you have 5 children. One out of those 5 children that you have may be suffering from some type of well mental health issue or just developing it, right? And then you can stop that. That's just 1 out of 5. That is so it's so how can I don't want to say.
Is it only I? Did we lose Dr. Janak?
Yeah, she's glitching a little bit.
Yeah, I see that. I see that. But what you were saying, which I think is really is crucial, is like if anybody is at home and you have 5 kids in front of you, is what this statistic is saying. Right, Rachelle? If you have 5 kids
Mm-hmm.
in front of you, or
Mm-hmm.
you're getting together and you're looking at a table, that means like one of those kids is dealing with something.
Something. Yes.
See? One out of that 5 is
She
dealing with something.
do something.
And
She's back.
right?
Mm-hmm.
Okay, you're back, Dr. Janak. Because I
Yep, I'm back. I'm back.
yes,
I'm not sure. Yeah, I know you got me. You got me.
got you.
So, were you able to do it? Am I able to go to the next slide?
Yes, please. Yeah.
Okay, thank you. So I'm going to talk a little bit about the developmental milestones and the behaviors that are in the that can be indicators of the mental health issues and the key milestones and behaviors to look out for, and the importance on like why is this part important. So when it comes to social and emotional development, I'm going to use the Eric Erikson stages of psychosocial development to kind of explain what I mean about these stages. So with the Eric Erikson, so trust versus mistrust. Erikson believed that infants develop trust when caregivers respond consistently and reliably to their needs. So this stage set the foundation for future social emotional development. So like how you were saying, Dr. G, when they come to you, they're already adults, right? This can, right at the very beginning, the way you treat your child um, will will be the foundation on how they develop trust into other people. Autonomy versus shame and doubt. When this is from like 1 to 3. And during this stage, toddlers explore their environment and test boundaries. They develop autonomy when they are allowed to make choices and take risks. So these are all natural behaviors, and these are from toddlers from the very beginning. And then for initiative versus guilt, this is from 3 to 6. Preschoolers take on more responsibilities and initiative and activities during this stage. They develop a sense of initiative when they are encouraged to do to challenge themselves and do new things, right? However, in trust versus mistrust, if an infant needs are not met during that developmental stage, they it leads to mistrust, right? It leads to difficulties forming healthy relationship with others. So you see at very age of from 0 to 1, these children are already learning whether they can trust and not trust people in a healthy way. They if these needs are not met, anxiety and fear comes in, aggression and anger issues come in. All of that formulates from the very first trust and mistrust. Trust versus mistrust. And then for the second stage, autonomy versus shame and doubt, right? If a toddler's needs are not met, they may develop shame and doubt and leads to low self-esteem, self-doubt, lack of confidence, and difficulties making decision. And I'm going to highlight with this section, and I can only speak on the Haitian population with this because I'm Haitian and I come from a Haitian household, right? This section right here, li très important pour parler, faire attention avec Patissa, because, well, no, not just a Haitian population. Sometimes children's voices are not heard, right? Like kids are not supposed to be heard. They're supposed to sit and listen. So then now everything that they say, they start feeling shameful if they start speaking up for themselves. If they look a person in the eye, they start feeling shameful because you're not supposed to do it in some particular cultures, right? And so just from the very beginning, and then so when the kid get older, they're being forced like, you have to speak up for yourself, you got to be assertive, public speaking. But from the very beginning, they were deprived that. I have to say deprived because they were shut down when they tried to do it when they were just toddlers, right? Because that's when they're supposed to be trying to, spread their wings and, develop some autonomy, but they were shut down. And so now it makes it extremely hard to kind of develop that when they become adults, young adults. So initiative versus guilt. If the preschoolers' needs are not met, they may develop guilt, which leads to being overly critical of themselves, which is very harmful because the world is already very harsh and they're pounding them. So like if they already have internal self-doubt about themselves, it's going to be hard for them to do things. They're going to be fearful and taking risks, and it's going to be really hard to be assertive, which will cause them to become people pleasers, which leads on to a whole lot of anxiety that they have to deal with as a young adult. And so for language and communication, I'm using the Jean Piaget's model of cognitive development that explains some of this. So in the pre-operational stage, which is between the ages of 2 to 7, he believes that preschoolers develop symbolic thinking and begin to use language during this stage. They start understanding words and symbols to represent ideals. And in the concrete operational stage, which is about 7 to 11, during these stage, children develop logical thinking and begin to use concrete objects to solve problems. They understand cause and effect in relationships and classify objects into categories, right? And so in this stage, once their needs are not met, issues start happening, like they start having language delays, difficulties with symbolic thinking, and trouble understanding cause and effect in relationship, right? Early intervention matter. And everything I'm saying here is just from birth to about 10 years old, birth to about preteen, right? This is actually the time where we have the most control over our kids, and we can kind of like form which direction they're about to go in. And then for cognitive development, we still use the Jean Piaget's model because he speaks on the sensomotor um, aspect where he believes that infants and toddlers learn by using their senses and motors during this stage to develop object primacy, which is the understanding of like things still exist even though they're not in sight, right? So knowing that, just because a person's not present, they're still there, doing what they have to do. And this is at this stage is really important because kids have to kind of like start learning these things. And also with the operational and concrete, I've kind of like mentioned that. And for the physical development, also let me also speak on when those needs are not met. Kids end up having delay in cognitive development, difficulty with object permanency, and trouble understanding cause and effect in relationships. They also have difficulties with symbolic thinking and trouble understanding, and having language delays. And so for the physical development, I use Arnold's Arnold Gasell's, and in this stage, he believes that physical and cognitive in this physical and cognitive stage that reflexes such as sucking and all of that is kind of like part of the development and the way children do things. And in toddlerhood, toddlers develop physical and cognitive um, knowledge and begin to walk and talk and use the toilet. And then they have to have somebody there to kind of guide them, to show them how to do these things the appropriate way. And if those needs are not met, they'll have delays in their reflexes, delay in coordination and balance, delays and just everything else. So from these very stages, all these very stages, it is really important that foundation is set, because delays or disruption in these milestones can be indicative of underlying mental issues, which again, this is the key time where we have so much control over our children that we can kind of like help and guide them to make sure. So when you see people at an early age and you're trying to figure out what usually people will say, what's wrong with this person, instead of saying what happened to this person, right? Because what happened to this person is taking the blame off of that person and trying to figure out during these developmental stage what went wrong during these times. So yeah, like you said in this message, in a nutshell, paying attention to the your children, any of these children, because the signs and symptoms are already there, and this is the time that we have so much. I don't know if I want to say power, but we have so much influence on them because that's when their brains are developed. They are eager to learn, and we can help in this stage, right? So early warning signs and symptoms of mental issues can manifest in different ways in children. Some common signs and symptoms are the change in their behavior. So sometimes they become moody, irritable, anxious, depressed, right? And so with the anxiety section, you'll see a lot of more of a social type of anxiety or separation anxiety. They want to be separated from their parents because in some of those developmental stage, they weren't able to grow or learn from those sections, so they feel an attachment that causes so much anxiety. And then with children and anxiety, when it comes to children, the two most high things that cause anxiety is academic performance and they're athletic, if the kids are in athletic or extracurricular activities, because although they are already putting a lot of pressure on themselves, they also have the pressure of their parents to excel well and do well. Being withdrawal or avoidance, social isolation, refusal to participate in activities. Dr. G, you kind of touch up on some of these parts earlier, right? You'll see that they isolate themselves a lot more, and it is your job to kind of, I know we are very busy people too, but taking the opportunity to find out why is this child isolating themselves? Because we do live in a world of social media. Allowing the child to just go sit in their room and then scrolling on social media. Now you have somebody else helping, healing whatever it is that they're going through, which a lot of the time may not be the best way of healing or coping with the situations that they're going through. Increased anxiety and fear. So they have excessive worrying, phobias, and nightmares, right? And so those are signs that you pay attention to. Difficulty sleeping or eating. So when you see that kids have a change in appetite, or sleeping pattern, right? And that's, again, the key thing is to pay attention, right? Because once you see these things start shifting, that's when you should know, oh, this might be something wrong with my child. My child is sleeping way more than they usually sleep, or they're not sleeping. They're not wanting to go to sleep at all. What's the problem? So these signs are there, or even with the appetite, they're eating more or they're eating less. Paying attention to these things will really help. Or if the child starts complaining about some physical symptoms, right? I'm having headaches, I'm having stomach aches. Find out what exactly is going on, because these are not just regular signs of this child may just have a headache or a stomach ache, which it very well may be, right? But these are still signs that something else, it might be an underlying issue. And so it's very important to try to um, do some investigation, taking some time out to see what's going on with that child. So some screening tools and resource that can be used to identify um, some interventions for mental health issues. Some common ones are the PSC, which is the periodic symptom checklist, which is used for children with mental health issues. The strength and difficulty questionnaires is the screen that helps with emotional and behavior difficulties. The CBCLs is one I know I use a lot with the foster care system, which is a comprehensive screening tool for children behavior and emotional. It's a checklist that the parent and educators kind of use, because, and that's the reason why educators and parents are caregivers are really important, because with most of the diagnosis for young children, it needs to be in two different settings to see like if the behavior is happening at home, but is it also happening in another setting like aftercare or in the child's school or at a camp. And with these questions, that way you can see like if whatever the parent is seeing at home, they're seeing outside as well, when the child is not in the home setting. And then the ACEs, the Adverse Childhood Experience checklist, which is a questionnaire for about 10 items that talks about child's trauma, abuse, and neglect during childhood. And it helps identify who may be at risk for developing a mental health issue and or experiencing a negative outcome. By doing these screenings, you're able to kind of already, most of these screenings, you start doing them when the child is 1 all the way up to teenage years. So you're able to kind of already see things as they start developing. So the tools are there. All you got to do is do some work, do some homework, seek out some support if you feel like you need more support. So what educators and caregivers can do to help, right? Again, like I mentioned from the very beginning, caregivers and educators play a critical role in supporting children's mental health. Some strategies for supporting are being aware of warning signs and symptoms. And we kind of mentioned some of that warning signs and symptoms. And if you go on the Rebati page, we have a checklist of some of these signs and symptoms just in case you forget. And if you also go on Rebati's IG page, we have we have some pages posts that where we post some signs and symptoms and English and Creole for some of the parents that's Creole speaker, just to kind of see. And you can use some of these screening tools. So the screening tools that we have here mainly are for some of the professionals, but parents are able to look at those screenings too to see if your child falls under some of those categories. So providing support and non-judgmental environment is key to helping these children and encouraging open communication. What I tell parents all the time is it is really important to remember that you were once 10, you were once 12, you were once 15, you were once 5, right? So these kids have issues that adults may not think that they can relate to because they forgot, right? But now these kids are dealing with the issues that they're dealing with right now, on top of dealing with parents who were born in a different time, right? And then trying to put on some of their expectations on the children and forgetting how they handle situations. So now they have to deal with a parent who may not see things their way while they are dealing with the stressors at school. They're living in the world of social media, which is extremely different from the way most of us grew up, right? Like when it comes to bullying, they were not just being bullied in school anymore. The bullying continues on. It's from school, then you go home, you turn on your IG, Facebook, I don't know what kids use right now. I guess TikTok and all these other social media that they use, and the bullying continues, right? So now the kid don't want to come talk to you because sometimes the parents are just saying, well, I guess just turn it off. Or maybe I should take away your phone so you won't have access to social media, right? Those are not the answer. Try to put yourself in that child's shoes, especially when you were that age. That's actually one of the best advice I can give parents when it comes to trying to deal with the children. Try to put yourself in their shoes. Try to remember when you were at that age. So as I conclude this presentation, I am reminded of the impact that early identification and intervention can have on a child's life. As an educator, caregiver, and an advocate, we have unique opportunities to support mental health and well-being. And as a coach, right? Because the coaches do a lot of caregiving and education while they are with the children, because they spend a lot of the time. So we have this unique ways where adults play a role in children's life. So I urge you to remember that every child's story is unique. It is very, very different, and that every interaction that we have with them has the power to shape their future. So let's
Hello.
work together in creating a supportive and inclusive environment that allows for our children to thrive, giving them that non-judgmental space to help them do that. And by prioritizing mental health and well-being, that can help the children develop confidence and the skills that they need to succeed. And here's some of the resources. Do we have any questions in reference to?
Wow. I know everybody joins me. I know everybody joins me. Come on, we have to give it a little encouragement, give it a little thing. That was really awesome. Thank you so much, Dr. Janac, I think to
You are so
understanding the early
welcome.
sign, right? So any comments or questions, anybody want to add to the early signs? Remember, we are here as parents, we are here as professionals, we all have some of our own expertise also in this space. So while you're thinking about questions or comments you have about what you've heard around the early signs for screening kids, I want to give a shout out to Marie, who's joining us on Facebook, Dr. Planton, who's joining us on Facebook, who does U-Turn Youth, who's making sure our kids is a priority in the community. I want to say quick shout out also to Opal, who is also joining us on Facebook. We see you. Just want to say thank you for commenting on the site as well. Great to have you with us. So with that, let's see if there's any comments or questions before we move on to Rachel's presentation from anyone. Okay. Thank you, Brandy. Thank you, Brandy, for being here. I agree. That was a brilliant presentation. Really broke it down to us to really understand the early signs. We really hope that everybody goes back. That's why we're recording this. We're doing it live on Facebook. You can go back to it, take a look at all of these, so let's pay attention to what's going on early on so we know how to respond. So really excited to turn things over now to Rachelle, who's going to talk with us a little bit around, now that we know the early signs, right? But what are the strategies that we can be using to help us address the signs when we see them, right, among kids? So, Rachelle?
Exactly. Oh, thank you. This was wonderful. I hope I'm able to step up to that level. Great job. Thanks, everyone. And thank you for the opportunity to actually share with you all. It's, so many things have been said already. So as I was listening to the both presentation, I'm saying to myself, how can I make my presentation a little bit more less textbooks, maybe more experience-based. So I may switch it a little bit so that we can have a different perspective to some of the stuff that has already been shared. So when we talk about, so Dr. Guerda mentioned the importance of really the now of addressing some of these behavioral or mental health or the issues that some of our children, adolescents, and young adults may be facing. And Dr. Janac actually talking about the early signs, how do we identify them? Often us as adults, parents, caregivers, community-based workers, social workers, therapists, practitioners as a whole, we either have had our own personal experiences between how, if we have children or if we have loved ones or that we're caring for, and also as professional, how we serve our community. But it's also important for us to really be in tune with these signs, as Dr. Janac says, and also equip ourselves with the right tools to know how to show up for our children and the children that we're serving across the board. And how do we intervene, right? It's very important to really get a sense of how do we intervene. So my presentation will be based on evidence-based intervention, role of community, tips, and case example and resources is what I'll be tapping into. What are early intervention strategies? Action taken early to address developmental, emotional, or behavioral issues in children. Goal, prevent worsening condition and promote long-term well-being. So us as parents, caregivers, or practitioners, we often get very stuck on ensuring that we get the safety of our children, we provide what they need, their basic needs are being met, and creating a space that is very welcoming for them, where they're actually able to tap into different activities and education. And often the other component can be lost, right? The well-being. And this is sometimes cultural, right? That we don't really think about that. That's something that we have in the forefront of our mind. And it's like, what do we mean? What do we mean well-being? The kids is fine. They go to school, they have food, they have a place to sleep. What does that mean? Well, it's really important because connecting with our child or a child that we're supporting, a young adult we're supporting, connecting with them at a level where we were genuinely concerned about their overall aspect of their lives, their environment, their social environment, how they're doing emotionally, how they're doing physically, how they're doing mentally is crucial. And the earlier we start practicing that, we have a better chance of supporting a well-rounded aspect of a child's upbringing. So the evidence-based practices matter, backed by research and proven results, provide structural frameworks for predictable and positive outcome, builds trust among professional parents and children. So it's really, when we're raising a child, we're raising a child or we are in a child's life, it's not singular. It is community. It is every party. Everyone is involved. We've heard the saying before, it takes a village to raise. It takes knowing that I may not have all the answers, but I may be able to identify the support needed so that my child is well-rounded. And us as adults educating ourselves enough to understand that there will be moments that you as a parent may not be able to support your child in the way in which they need to be supported. They may not feel, again, like Dr. Janac says, there may be this sense of, well, I don't want to disappoint my parent. They wanted me to go to school and learn this, but I don't really want to do that. Or they're paying so much money for the school. Or, all my life I've heard education, education, education. And right now, I don't even know that's the path that's for me. Right. And that's one aspect as they get older. As the younger child may be more isolated, they stay in their room more. They don't want to interact with the other kids that they're with. They don't want to go on their play dates and stuff like that. Or you take them to activities such as extracurricular, and they do not have the social skills to interact, or they do not know how to, maybe because they were bullied at school, and we don't know that. So being in tune as parents to be able to pay attention and identify some of the cues that are being presented by our children is crucial. So that when identified, we're able to say, oh, something seems strange. Let me tap into the right support system. Or your child is in college or in different school or somewhere, saying they're talking to you, and there's some unspoken cues that are being delivered, and us being in tune and having the right tools in place to be able to identify, I may need to do something. Let me tap into the right resource to help me, because I am not equipped and I don't know how to address it, but I can provide you with the support to do that. So these are the little cues that is important for us to understand. And this is why this is so important for us to have. So cognitive behavior therapy is one of the evidence-based interventions, right? A structured, time-limited approach teaches children to identify and manage negative thoughts. Example, journaling, positive self-talk, exercise. This is something that a child will take with them for the rest of their life. It's tapped in early, because even us as adults, it's encouraged that we do that. So if we're able to create the path and provide them with the proper tool so that they can start processing what they're experiencing, it's will only benefit them. So this is where the cognitive behavior therapy is so helpful, and that play therapy for a young child focuses on expression through play as a therapeutic tool, effective for addressing trauma and building emotional resilience. Example of the tool: the centuries, role-playing games, where the child has experienced trauma, they may not have the vocabulary in place for them to actually express and share openly with their loved ones what has happened, what they have experienced. However, if we engage in play therapy with them, they may display or draw, right, something that's indicative of an action or of a trauma they had experienced. Other approaches: family therapy improves communication and resolves conflict. Another one, behavioral modification, reward-based system to reinforce positive behavior. So whenever a child is, you have a reward base, they're doing something that is aligned with what is positive, you reward them with, let it be a gift or a gesture or something that they make them realize, like, oh, I am doing good, right? Family therapy improves communication. Identifying a therapist that is aligned with some of that you feel comfortable and you feel that is, you have to do your research, of course. Identifying the right therapist for your child is something that's important. That's one, us as adults, take the time to research to make sure there's a right alignment between your values and also a right fit in terms of personality for the child, so that they feel safe, comfortable, and feel the sense of openness with the person they will engage in conversation with in therapy. So the role of schools, right? Creating a safe environment, anti-bullying policy, emotional wellness campaigns, establishing of a calming zone for stressed students. That's something schools could create to help address some of the issues that some of our kids may show up with. So that's one intervention. Intervention programs in schools, school-based mental health team, counselors, psychologists, and social workers available to support a child that is in need of mental wellness. Social and emotional learning, SEL, teaching empathy, resilience, and emotional regulations. That's another approach to where that can be taught to a kid, how to manage and how to show up when they're feeling a certain way. Crisis intervention teams, ready to respond to urgent situation. These are all intervention programs that can be put in place so that our students, our kids, have the support they need so that they could thrive as they grow. So that's one thing school system can actually do. So our community, the role of our community, building collaborative networks, coordination between schools, mental health professionals, and families, leveraging local not-for-profit for funding and support, creating space and programming so that our kids can have the support needed and have a path to gaining not only the support, but also heal for whatever they're experiencing at the moment. So there are ways that we could tap into resources, funding, potentially grants that that the community at large could create so that our kids have the tools and need to thrive in their lives. Community-based program, example, after-school therapy program, peer support groups, accessibility, free or subsidized option for low-income families. Again, saying that there are a lot of different fundings out there and that could assist us in creating the programs needed so that the community at large can support our kids. As I mentioned before, it takes a village. What a parent or a family is unable to provide, potentially because parents are not equipped emotionally, potentially, to provide that, or financially. They may not have the know-how, but a community could step in and identifying that there are behavior, we're seeing these kids out there, behaviors are not fully aligned. What can we do? What can we put in place to ensure that they have the support needed to become amazing member of society, so that we decrease the lack of graduations in high school, so that we decrease the other behaviors that are more traumatic or more the homelessness and failure, all these, incarceration, so we could reduce that. The community steps in, providing the right programming like such, so that the child, the adolescents, the young adult have the support needed. Engaging stakeholders, encourage parental involvement through workshops and seminars, advocacy efforts to secure funding for local mental initiative. As I just said, sometimes our parents are not equipped. They do not have the level of education. They don't know how to identify some signs. They don't know what to do. Creating space for them to come learn education is key. Bringing them in, creating workshops for them to say, hey, this is such as now, right? Creating these webinars so that families are aware of what's available to them and how they can actually better support their children. And this is the role that us as community members can actually provide in terms of creating the intervention necessary for our kids to thrive. So practical tips for supporting children. So for example, for anxiety, practice grounding techniques. 5, 4, 3, 2, 1. Sensory exercise. This is a basic tool that we could work with our children with, right? Again, culture plays a role. We'll tap into culture later. We each have different ways and different approach to how we parent, and how we deal with certain issues, and then depending on how our kids show up. Some tools here may not be something that we're necessarily acquainted with, because this is not how we were brought up and how we were taught, and we believe that the way in which we were, however way our parents taught us, and we're okay. The perception that we're okay. But yet, these are research practical tools that shows that if we are engaging with our child and we actually use these techniques, sensory exercise can help reduce the level of anxiety so that you could actually have a potential conversation and understanding what's going on with the child, so that you could calm them down and be able to move forward in their day. So it provide consistent calming environment. That's what it does. It helps calm down the energy. It calms down the frustration. It calms down the pain. It calms down whatever they're going through at that moment that makes them feel this level of anxiety, so that they can eventually verbalize what they're experiencing and move through the day in a more peaceful, calmer environment. For depression, validate feelings without judgment. Again, this is where I feel culture comes in as well. We all parent differently based on how we were parent and what we know to be okay. The calmer we are in addressing a situation with a child, allowing space for the child to come in when they know no matter what they're sharing with you, you will not judge their thoughts, their behavior, and how they're showing up, is one of the best approach to engage in conversation and leads to positive outcome. It is so important to be able to have that level of openness, judgment-free. so that the trust is built and the willingness to share is there. Encouraging manageable, enjoyable activities to restore hope. That's one of the things we're trying to encourage. Manageable, enjoyable activity to restore hope, so that it's helping a person, a child that's dealing with depression. The more soothing the space is, the more comfortable they are in sharing and wanting to step out of that feeling of feeling sad, feeling of depression, of not wanting to continue to live, knowing that there's a safe space for them to come to. For behavioral disorders, develop clear expectation and consequences. So the rambunctious perceived child, it's not necessarily the best, oh, what are you doing, and talking down, but also creating expectations, saying, hey, if this happened, that will be the outcome, and be consistent with that so that they know what they will expect based on how they behave and the consequences that will come from that. Speak it, ensuring that they understand it, so that when the consequence occur, that it be, you would not be going to this party, or you would not be having this particular treat, they know what's coming. So collaborating with professionals to create a tailored behavior plan is crucial. If one does not know how to create these, speak about expectation or consequences, this is where identifying and tapping into a professional to help create that, so that you, the family, or the caregiver, have a plan that is consistent in terms of what's expected and what's the consequence will be. And it's also it's kind of having a contract with a child, right? It's saying, hey, okay, we said, this is the behavior we're having. What's going to happen if we continue? Or we agree? Do we agree that if this happened, we're going to do this? It will be the outcome? Everybody's on the same page. There's no last minute unexpected action taken. We spoke about it, we agreed, it becomes kind of like a contract somewhat, so that we're all on the same page. And definitely a professional is someone that can actually help create that if a parent or a caregiver does not know how to go about doing it. So a case example. 10-year-old Sam struggles with social anxiety, avoiding group activities at school. Intervention steps conducted on initial assessment with a school counselor, right? Second, implemented weekly CBT, which is cognitive behavioral therapy sessions with measurable goals. As we talked earlier about having the goals, having a plan, everybody's on the same page. Created an individualized plan with the teacher presenting work to small groups before transitioning the larger audience. So if a child is having a problem behaviorally and is not able to behave in a way that is in alignment with what the institution is, then creating a plan so that we are working on the behavior on a one-on-one, and then we're going to have a small approach on how we're going to introduce you to a small group, and then we could get into a larger group, okay? And then the fourth one is engage Sam's family and supporting strategy at home. How can we take what we've learned from the school, from our session, or from our community groups that we've been to, and how can we bring this plan home so that mom and dad are equally equipped to help Sam move through his daily, so that he could be less rambunctious, so that the bullying that he may be displaying is not something that he continues, or potentially have tools in place as well, so that if he's being bullied, how he needs to address it. Gradual improvement in confidence and participation in group setting. So now Sam have had all these things in place. Everybody got involved. We had an assessment. We have we implement a weekly behavioral plan. We have the right individuals involved to help us. And then now mom and dad are home. They have that at home. Everybody's hands on. So it's not a singular approach. It's a communal approach. It's home. It's the home. It's the community. It's the school, it's the loved ones potentially around us to have, okay, we're all hands on deck We're ready to make sure that Sam is thriving. And if Sam has the right tools, so that when Sam goes to college, he's a better version of himself. So when he goes see Dr. Guerda in college, she doesn't have to address some of these issues. So this is what we start doing early on and hope that the outcome is more positive. There's a level of confidence and there's a level of acceptance of self, so that Sam, as he grows, he becomes a much stronger, thriving version of himself. So, conclusion and resources. Key takeaways. Evidence-based early intervention help address root cause effectively. Collaboration between schools, communities, and family is essential for success. Everybody needs to have their hands involved. Practical strategies empower children to thrive emotionally and behaviorally. Resources, National Alliance on Mental Health, school counselor resources, local therapy program, crisis support, 988 suicidal crisis lifetime. Like we are all, we live in an ecosystem. Life is not a singular experience. It is a dynamic, multifaceted experience. When raising children, all people need to be tapped into. We need to tap into our resources that are outside of ourselves, but also our resources within us. If we cannot address or cannot support our children, or a child is going through a rough time, an adolescent, a young adult, and we are unable as parents to support them in a way that they feel they could talk to us, this is where you activate your community and you ask everybody to hands on deck. A auntie, a uncle, a grandmother, someone that you know that you feel comfortable, that your child feels comfortable to speak to. That's one way. Hey, everybody has to get involved. You need to check in with my kid because they need the support. With that fails, then you have the other resources. Where can I tap into? Who can I speak to? Can I speak to a guidance counselor at school to say, hey, this is what I'm noticing. Can you check on my kid for me? Have a conversation and reach out to them and see how they could talk to you. Or if there's other community-based, that'd be churches, other community-based organization that you're part of, or even if you're not part of, but tap into that so that you can actually get the support needed to provide your child the right level of support so that they can thrive in their lives and across their community and become amazing member of society. Thank you very much for the opportunity. It was really wonderful talking to you today.
Wow, 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 wow. Lagi puli, balot bagay, bali, bali,
This is
bali.
great.
Right? Give it
I
to
wish it was
her.
available when my kids were little.
Right? Oh my goodness. So those of you who are joining us now, let me just tell you very quickly the journey we've been in. We are very clear that the problem is real. That's why we started with. We said the problem and what's going on with our kid is here. It is happening and it's real. We cannot ignore it. We cannot, avoid it. We have to do something and do something now. But Dr. Janac talks about the early signs so that we know. So if we admit that the problem is existing and it's here and it's in front of us, it means for nous ouvrir yeux nous, ouvrir oreilles nous, okay? Pour nous pour nous attendre. We have to open our eyes, open our ears so we can see those early signs because the signs are there. Whenever we're talking as professionals ourselves, we are talking to families and they're like, and something awful happened. They're like, they can go back and they're like, I can see the signs now. There was some sign that told me that something was off or something is not going okay with this child. So we know that the signs are there. Here's the brilliant news that Rachelle dropped today. There are strategies. There are things we can absolutely do. Once we see the signs, there are good interventions that we can do to address these issues. So whether or not we are talking about the individual interventions, as you mentioned, with cognitive behavior work, or family interventions, but even interventions for educators, even interventions for the priests and the pastors and the people in the religious communities. There are interventions for them as well to know how to How do we address these particular issues and so forth? So it's not that we don't have strategies out there. We do. They're here. They're available for us to be able to be able to use. So I want to leave us, because I think something that both Dr. Elise in the chat and Rachelle, you mentioned, that is, it is the role of the family unit. So I want to leave us really with that, because it is a foundational area that we really need to pay attention to. And we didn't even mention music, dance, sports, all of those things that are really important in terms of like intervention. Like, right? So it's not just the one that there's science for. We also know the things culturally that are really important, like, dance, the art, and all of that, which is really is important as well. I want to just turn to us very quickly on the role of the families, and then we'll turn things over to you guys to share your thoughts on as well, just to wrap us up a little bit around the importance of this. Let me be very clear when I'm talking about the role of the family. I'm not talking about the people who just give birth to you. Okay, I'm not talking about, there used to be a time, many of you here who's on the Zoom remember those times. I got spanked by everybody. If I did something, I didn't have to wait to get home to get spanked. Everybody, the way I did it, spanked me. The people who heard about that I did it, spanked me. And I didn't even understand, because we didn't have phone in IT. I didn't understand how my mama knew what I had done way down to the ravine before I got there, right? And so on. There was a sense that the family was not only your blood relative, but it's also all the people that are around you as well, which means we have a responsibility to the larger family, to the kid as a part of this tribe. They are a member of our tribe. My kids say all the time, somebody's gonna whoop you up because you're all up in people's business about their kids. Because I'm like, those are my kids too. I just didn't give birth to them physically, but they're mine too. And I have a responsibility to making sure that they're okay if I see them engaging in certain things in the community, right, as well. So we have to be able to pay attention to how are we supporting our families, because here's the reality, and that is kids are part of lots of systems, as Natacha and Rachelle mentioned. Whether or not they're a school system, that's a system, or they are part of the community, that's a system, but they are part of our family system as well. That is their starting point, right? That the people that they are around, the aunties, the uncles, the grandparents, as well as the parents and the godparents and so forth. And we know that if the unit is not healthy, if the people, let me repeat that, if the people in the unit are not healthy, then they cannot raise healthy and resilient kids, right? And so making sure that we are healthy as individuals in the unit is the starting point of making sure that we have healthy kids, right? And so as Dr. Elizabeth mentioned in the chat, like we're dealing with adults who don't know how to regulate themselves. So how are you going to ask your kids to regulate themselves, right? To breathe when we ourselves don't know how to do that kind of work. So I want to very, very quickly talk about how important it is and the important role that our families are playing and the interconnectedness that exists between all of those systems that we are talking about, right? Here that Rachelle just brilliantly talked about and so on. So as a family unit, we have to be able to recognize that we are playing a central role in our journey for having a healthy child, right? And most of us here who are working with young kids know very well we don't do kids work without the family work. I will not see a child myself personally unless I'm also able to work with the system, the family system in which that this child is in, because we recognize that that is an important, again, doesn't have to be biological, doesn't have to be those who give birth to it. Whatever system that the child is in that is there to support this child becomes really, really important. So there has to be a recognition among all of us that oftentimes the family environment needs intervention. That many of us here must recognize that families themselves need interventions. I was having a conversation with somebody very recently, and they were asking the question, because they're like conflictual all the time. And they said, but we're staying in this relationship because we're waiting for the kids to grow up. And I said, well, that's the worst possible thing you can do. All the research shows us that that a child who's growing up in a conflictual relationship is actually do worse than if the child had separated parents, right, who had healthy relationship with each other, right, and so on. So there's a way that there's some things that systems are doing that we think is good for the kids, but may not necessarily be. So we have to take the time to
I
making
agree
sure.
with that 100%.
Thank you, girl. Thank you. Right? Like
Because
we
I
have.
grew up in that environment, and I prayed to God that my parents would get divorced, because that constant
because
in that environment too, they're not showing any love to the kids, to each other, and they all say they're gonna stay until the kid is 18. And I'm thinking to myself, you're teaching that kid that there's no love between two parents, and that it's okay for you to do whatever you want. There's a constant. So that's why I promised myself that I was not going to do that. You know, I got divorced this year, makes it 20 years, because I just did not want to give my kids that people staying and thinking that the kids don't know. The kids know. I knew.
Absolutely.
And I said to myself, I remember I was 8 years old, and I said to myself, there's no way in hell that as an adult I was staying something like this.
So to your point, Viola, what it does is that when the system is unhealthy and the child is watching that, all the things that Dr. Janac talked about in terms of trust and mistrust, all the things that she talked about in terms of social, emotional stuff, right? In terms of being able to develop good trusted relationship with other people, because it doesn't allow the child to have good model of what does conflict looks like. How do you resolve that amicably? It doesn't show the child about how this love expressed in a really an effective and impactful way. So it's actually a conflictual environment is the worst possible thing for a child.
It is.
So it's not okay for parents to say they're going to stay in it because of the kids. It's actually, you're not doing the child any good to do that.
Right. And then in my case, environment where I kept to myself.
Yeah.
Because I felt like I was the only person that I can truly count on.
Yeah, of course. Yeah.
It created this sense of over independence. People are always saying, "Oh, you're so independent," because I had to be. You know, because there was just constant conflict around me. So I stayed by myself a lot. I played by myself. I became very independent at a very young age.
Very young age, right? Absolutely. And there's many also kids who become parents to their other kids. They become very protective of the other parent. They don't want to share what's happening for them because they don't want to be, a problem to their parents, because they're already seeing some of the issues and so forth that's going on.
Right.
So that they are forced to become adults at a very early on, as opposed to really being a kid that's going to be playing, and enjoying life.
There is
right?
that too.
Absolutely. Absolutely. Thanks so much for sharing about that. So it is important. So all the things we're talking about in terms of what are some good strategies that families can use. So open communication is important, right, in the families. Most of the issues and challenges that we are seeing in families is connected to communication. Let me just say a question that you should never ask your kid or other people in your life, and that is, how are you? Okay, are you listening to me? Somebody asks you, how are you? You see your child and you said, how was your day? Guess what the answer is going to be? Fine. That's what we say. Go ahead now. Somebody say, Rachelle, how are you?
I'm fine.
I'm fine. That's it, right? Are you fine? No. Do you look like? No. Did you have a good day? No, you had a very hectic day. You had an incredibly difficult day today. When somebody say, how are you? We are already conditioned, right, to answer, I'm fine. So when we say to a child, you see the child, you pick them up from school, or they come, you say, how was your day today at school? They're going to say, fine. But they went from 7:30 in the morning till 3. There's no way the whole day was fine. So versus, instead of asking, how was your day? Then, how was math today? How was science today? So being very specific in your communication enable you. How was that meeting that you had today, with at work today? What are some of the things that happened today that were great? And what are some things that happened today that were very challenging for you? So imagine if somebody's asking you that question as opposed to how was your day? So there's a way that we have to think about the type of communications and the type of questions that we are asking to be able to engage in the conversation as well. Dr. Janac mentioned a number of tools that we've used that you can use to do the early signs, so I won't mention a lot of them, but just so you know that there's a lot of amazing tailored interventions that are available for families that allows for them to build a sense of trust, that allows them us to be able to address some of these things so that way we are not showing up as hurt people, right? In continuing to sort of like fostering an environment that really is not supportive and helpful to our kids. So I'm going to stop here because I really want to make sure we create some time to hear from all of you in terms of your own thoughts, your own reflections about what are some of the things that we are talking about today, but also to hear your own advice and ideas of like things that you've seen that is working. We want to create space for that as well. So with that, I'll turn things over to you. Please raise your hand, use the chat. We're following the Facebook as well, so we can capture things in there as well.
Well, one thing that I wanted to bring up that I experienced with my kids is that, living in America, we're living in a multicultural place, and whatever you're teaching your kids at home, necessarily what other parents are teaching their kids at home. So the problem that I had with my kids are, 26 and 23 now, but the problem that I had was, where are you going to be? I need to know who you're going to be with. You need to call me when I was very much involved. And so the other parents who were European and American found that behavior very weird. And they would tell my kids, why is your mother so overprotective? They were instilling things in my children's head that were not, in my opinion, overprotective. It was just a different culture. Just like I need to know where you're going to be, who you're going to be.
Absolutely. Absolutely. What's interesting,
what's happening, what's think.
Yeah.
But these people, I had such a hard time because the other parents were not like that. And so my daughter and I were always butting heads because they were embarrassing her with all the questions. Like, why is your mother like that?
And what's interesting right now, I can tell you, Fiola,
and
for all the parents,
why can't you? That's another thing that comes up too.
Yeah, absolutely. But let me just say this to those of us who are watching your kids now, talking about why that moment was important for them. So while it may seem like it was hard and overprotective, so all of us here, we see how we're shaking our head, Fiola, we were those parents. Mine did not, there was no sleepovers taking place. And before my kids could go to a birthday party at somebody's house, I wanted to know if they do drugs, do they have a gun in the house? I was very specific on questions that I needed to ask parents beforehand. But I can tell you that the kids now, the 28-year-old is saying how grateful they were to their parents, that they get it now, they understand it. So even though they may be giving you a hard time about asking the questions, we are here. Iola and the rest of us here are here to say to the other parents, keep up on that.
That's the one thing I feel like we need support on.
Absolutely. Yes. Eleanor? Joe?
Well, interestingly enough, I must say that I've always said that there should be there's all these award ceremonies being given out there. I wish there was an award for having survived being the minority. And when I mean minority, I'm not referring to color, but a minority of thoughts, a minority of values in the community in which I raised my children, because I was the only one with these values and these, and the way I approached it, and I survived. Regardless of all the kids coming back at me and Ford telling me, well, how come we're the only one? Nobody else does that, all these things that came with that.
Yeah, absolutely. I love that. It's like, listen, she told the people that, that she was different from her friends. I think we all said that. I think we all were like, listen, like my kids used to be like, but so-and-so's mom. I was like, oh, I'm sorry. My name is Guerda Nicholas. I don't know what their names are. You know what I mean? So we're not the same people. But I think we are here in our conversations with young adults. We are learning of how important it is to have that structure, So even though they're fighting against it, it's actually the thing they all absolutely need. So lo kite yo gaye, yo fe nepot bagay, they also interpret that as if in another way as well. So even though they seem to be fighting against that structure that you're putting in place, putting it in place enable them to say, it's not me who don't want to go to that terrible party, which they didn't want to go to begin with. It's because my mom won't let me go, right? And so forth. So it actually helps them, even though they can't say that. But when we're having conversations with them as mental health providers, they are telling us that, like, thank God I had that structure, right? Thank God I have that in place in a time when life is chaotic for me. So we are here to not only as professionals, but as parents to tell you all, stay the course in your parenting processes and not necessarily succumbing to the I don't want to say American way, because we're all American, it's just the United States way.
Put the therapy money on the side.
Yes, exactly.
When the time comes.
Exactly. So if anybody else had any last thoughts before we close out for today?
Well, as we close out, just something I want to piggyback off of that what Gasha said about validation, because I know sometimes, we misunderstand what validating the child's feelings mean, right? Like, no, I'm not going to just agree with whatever they have going on, and understand that validation does not mean you agree with them. It does not mean you agree with them, but it just simply means that I hear you. I see you and I hear you, okay? And that's it. You're not agreeing to whatever, thing that they're doing that you disagree with, you think that's wrong, but that's not what you're hearing right now is that child's feelings. And you're just validating them so that they can feel heard and seen. And that is it. That's simply it. That's why it takes a lot of practice for you to be able to validate somebody, because sometimes people just feel like, oh, I'm not going to agree with what they're doing. No, it doesn't mean that at all. It's just making that person feel heard and seen.
Absolutely. And I love that Liz May's comment in the chat, right? Because we all need boundaries. Adults need boundaries. The adolescents need boundaries. The 2-year-old need boundaries. That's why we put little things on the wall so that they can stick their fingers into the outlet. Everybody needs boundaries. As she said, if there wasn't any speed limit, how you get in your car, you would go as fast as you want, right? If there was no stop sign, you probably would have, like, all of that. Like, so having the boundaries is something that we all need. And so as parents, we don't want to see that as something that shows that we are being rough or tough or, lack of understanding. It is all about the way that we are doing the very best that we need to do as parents. So as Rachelle says, we don't have an award for parent, and we know that there's no playbook on how to get this right. There's none. I wish there was a perfect book, because every single kid, even I have 2 of them, each one of them are very different. If I had a playbook, it would have worked, but it wouldn't have worked, right? Because they're all very different kids. And so, but what we do know is that if in fact we are working on ourselves and we are doing well by ourselves, and I'm in a good place, then I'm able to be in a good place with my kids. If I understand me better, then I understand who I am and the type of parent that I am, then it makes sense as to why I'm putting these boundaries in place, right? So that I can explain it to the child. So the more of this stuff that we are doing for ourselves as adults, then the better we're going to be for our kids, and the better relationship that we're going to have with everyone. So with that, I want to just ask my colleagues here for closing thoughts that you want to leave, right? That you want to leave with our colleagues here today, with our families, the young people who are watching, the young parents out there who are just starting out and trying to figure out, how do I make this work in this time and age, this day and age. So let's see who wants to kick us off, to close us out.
You could go. Oh, so what I would like to say is, in this day and age, we're constantly talking, especially within our own generation, about wellness as a whole, and not lose sight of the importance of also pouring into the wellness for your child, for your children. So wellness is a circular thing. It's all aspect of it, and mental wellness is equally important. mental wellness, well-being. So as we pour into ourselves, let's also be conscientious in pouring into our children as well in the same way, and validate and honor and put their well-being in the forefront as well, because they need it too. Thank you.
Awesome. Dr. Janac.
Yes, and just kind of like piggybacking off this no playbook, right? There's no playbook. And I know we gave you a lot of tools now, just using what we just said. The main thing is that all the children, every child is unique, right? All you have to do is pay attention. They kind of tell you what they want and need if you pay attention to what's going on with your children. That is it. Just those common signs and symptoms. You pay attention to them, you won't need that playbook, because again, every child is different. And you just, as long as you're paying attention, you will be able to give that particular child what they need.
Absolutely, absolutely. So with that, we say thank you to everybody to come. I say all the time to everybody in terms of mine, I say, that I am incredibly blessed because the Lord felt the need to let those two come to me, right? For me to play the role and making sure that I'm supporting them on their journey, but they don't belong to me. And there's a way that we think of young people belonging to us as if we did something for them, they owe us something back in return, right? We had a role to play, and that's what we're trying to do to the very best of our abilities is to do so. But I'm really hoping during this holiday season, during this time that we are in, where there's a lot of conflict taking place in our community, we as adults are having a hard time having conversations with each other, that we are going to take the time to also engage our young people in conversations about who they are, what's happening for them, what they're thinking about, what they're feeling, and what they're experiencing, overall. And know very well that there's a team of people who are here. There's a team of people who are here to support you as parents, to support you as caregivers. And if you're a young person watching there, know that there's a group of people who you can reach out to. Rebati Sante Mentale is here. You can absolutely refer to any one of us. Reach out to Rebati. If anybody is in need of services, the help is out there. We do not have to engage in drastic solutions. You just have to reach out. So if you're a parent and your kid is struggling, please reach out and connect with one of us so you can get the support that you need as well. So thank you so much for making the time on the Saturday, for joining us here on the Zoom. Thank you for all of you for participating on this Zoom. I am super excited to see Dr. Raphael in this Zoom. So good to see you, Sister Fran. Hope all is well with all of you. Wishing everybody the most happy and healthy holiday season during this time. And we look forward to seeing you at the next one. Thank you so much, Dr. Janac. Thank you so much.
Thank you. Same
Rachelle,
to you. Good seeing you guys.
Good to
Bye.
see you all. Thank you.
Bye.
Thank you so much.